put a lot of multiple subparts of the question. It's just a single question. You can type in the chat box. Okay. And I have put the national guidelines also. You can download from the chat box. Okay. The concept of birth companion was introduced in which national health program? So, people are typing or not typing? Raised hands. You're not able to type?
They have to answer in the chat box only.
Yeah. So, okay.
And they were
Somebody
answering while Viva was going on.
yeah, they were answering.
So they are able to answer.
Okay,
It may
then
be
we'll.
difficult.
Acha, it is. So
No,
it's
for them, just not read. So
no, that's fine. So Lakshya program is there, no? So national programs, one or two for matlab of our relevance that you should know. Important days you should know. World Breastfeeding Day, theme of the day. So these are scoring things in the OSCE as well as in your station vivas. So that can be done. So it's labor room quality improvement initiative, which is also called Lakshya. So as per this, a birth companion is allowed inside the labor room. Okay. So again, this is which month is celebrated as Newborn Screening Awareness Month? This one also would be, I think, difficult. September. Okay. According to New Ballard score, score of September. Good, Navdeep. The score of 0 corresponds to what gestational age? It is also called New Ballard or expanded extended Ballard scoring. So a score of 0 is what gestation? Yeah, Satish has told 24. Dr. Surinder has told 24. 24 it is. So as per the latest NRP guidelines, what is the recommended good Soumya? What is the recommended normal saline flush volume after administration of IV epinephrine? Please type. Very good. So NRP should be actually crisp and clear to everybody, including the steps and sequence. So that is important. Yes. So can anybody attempt this? Rector's behavior state we were trying to discuss in the case also. But since it's a actually dedicated neurological examination is separate, so I didn't go into details. Eyes open, irregular respiration, moving limbs, but not crying. Yeah, so there are states of sleep rather than alert active. There are states of behavior. It's not called sleep. You assess for behavior only when the baby is actually, you seem that he's not sleepy. So state 4 is the right answer. Just go back and read it. They are given in your books. So I have not put the explanation. So can anybody expand what is CAN score in terms of fetal growth restriction, IUGR baby, small for gestational baby? What is the full form of CAN score? And what is the least and maximum score for CANs? Yes. So many of you have written it right. Clinical assessment of nutritional status, CAN score. Yeah, it ranges from 9 to 36. And as you can see, there are parameters from head to toe, hair, cheek, neck, chin, arm, back, buttocks, legs, chest and abdomen. And we assess for the basic concept of fetal growth restriction, that is loose folds of thin skin, no fat at all, and lanugo and also all these things we see, and then we assess the nutritional status. So which scoring system is commonly used to assess the severity of opioid withdrawal in a neonate? So this must not be a common scenario in Indian setup yet, but We do assess for withdrawal of opiate if the mother has received any drugs. So any scoring system you know of? Anybody? Pen again. Simpler one. So NAST is one, Unital Abstinence Score Tool. And these are given in your standard textbooks. So you can just have a look at this. Uh, Anybody can name one pain score? It's not a part of OSCE, but any pain scoring? NIPS or PIPS? Good, very good. AVPU to alertness score hai, Navdeep. Yeah, PIP is fine. So what is the principle behind, you should know common concepts about the common equipments used inside NICU, which includes phototherapy, pulse oximeter. NIRS is a little advanced one, ventilator, CPAP, as sir was also asking. So components of your equipment which you are using, the settings, the regulatory mechanisms, how do you titrate those things, so you should know. So anybody, what is the principle behind near infrared spectroscopy, NIRS? It's a common one for many things. Even for pulse oximetry, the same principle is used. Yes. Spirophotometry, no. So Beard-Lambert law, the reflected versus the absorbed wavelength ka difference, the distance between the two. So these things. So coming to nutrition, as per Esfagan 2022 guidelines, what is the recommended vitamin D intake? तो एस्फैगन का एक फ्रंट पेज पे 2 पेज का समरी है, so that you should read. So little change is there. 400 to 700 international units. Now it is per kg per day. There is a table of difference also given between the earlier Esfagan and the 2022 Esfagan, and this time in the fellowship exam and MCQ was also there. So options can be 400 to 700 international units per day, and the third option could be 400 to 700 international units per kg per day. So now it is per kg per day. So please remember, as per 2022, suppose a 1 kg baby, 1.2 kg baby is there, so it is per kg per day. But you should not exceed a maximum of 1,000 international units per day. So I think Soumya is right here. So just remember, earlier we used to learn 400 and 800 absolute value, but now it is per kg per day. So again, this is intrauterine infections, sticking to the seropositive background. So this one is born to a mother who is VDRL positive in the first trimester, and mother was adequately treated. The serological titers of the mother during pregnancy also remained low, with less than 1:2 and 1:4. So neonate was born normal active, and the quantitative non-treponemal serology was also low. So what will be the principle of management of VDRL in such a neonate? So would you like to give any medication, any prophylaxis? What would you like to do? Would you like to investigate, or would you like to just leave the baby alone? Any answers? So syphilis is also well covered, and congenital syphilis is again upcoming with a lot of guidelines coming. The national program also for elimination of syphilis is there, recent one. So there may be a short note or a question on that. So just read about this. Flaherty gives it well, and other standard textbooks also, I'm sure. There are 3 or 4 categories as per the treatment received by the mother and the symptoms in the newborn. So this newborn is asymptomatic. The mother was adequately treated and the titers were low. So you would like, yeah, that is true. Resuscitation is fine. In terms of syphilis, I'm asking what treatment should be given. So for syphilis, no treatment is recommended because the mother is fine. But if you feel that the baby will not come for follow-up, you may just give 1 dose of benzathine as per some consensus. So this was about the syphilis. So look at this picture. This is from the standard respiratory physiology book. So what is this pathophysiology called? And name one clinical condition in which this mechanism is seen. Very good. Yes. So most of you have answered it correctly. It is a ball valve mechanism and seen in meconium. So the last question. So can you identify this plot and what does this middle arrow represent? Hmm. Good, Ashwini, and I think others who have Sukesh. The box is correct, and the middle line, most of you are not answering. So it's a box in visceral plot for, and it's the median. Okay, interquartile range. So these are 12 questions. I think it will be shared with you all. They will be shared with you all. Yeah, that's all
Thank
from
you
my
so
side,
much.
ma'am. Yeah.
Thank you so much, Dr. Pratima and Dr. Ashish sir, for excellent session. Now we can disperse. Thank you for the excellent OSCE, ma'am. Thank you.
Thank you.
Thank you, sir.
Bye, sir. Good night. Good night.
Night, sir. Good night.